Yeah, if you're ready.
Okay.
Go ahead.
Yes, sir. All right, hello, Michael. My name's Joe Salvano, student from ETA. I'm gonna go wash my hands.
Go wash it,
Go wash.
Go wash
All right, I'm going washing.
Where'd that young man go?
Okay.
What happened, Money?
If shaking too much, the camera's going.
Yeah, just leave it there for now. We'll have a garbage.
All right, so I wash my hands. Okay, so are you on any medication that you want me to do?
No.
No? Okay. What's your past surgical history? Any surgeries I should be aware of?
No.
Okay, past medical history, any that I should be aware of?
Stroke.
Stroke, okay, got you. And then what was your prior level of function or
I
before?
worked full-time.
Worked full-time, okay. And then like social history in terms of like activities like drinking, smoking?
Yeah, I smoke. You got a problem with it?
Okay. Let's see, what do medication, okay. And then,
Right, CB?
right, yeah, I was asked, yeah, true. And do you have any other questions for me?
No, my ankle hurts.
Okay. All right, I'll switch off to the next person. Oh, pain, oh, that's right. On a scale of 1 to 10, what is your pain?
5.
5? And then can you describe it as like sharp, dull, aching?
Sharp.
Sharp, okay. All right, thank you.
Thank you.
Yeah, I always forget.
Okay, somebody check, Joey?
I'll check.
How you doing, McKelly? I'm gonna take your blood pressure, is that all right?
Does one have a tag, Joe?
What's that?
One have a tag? Yeah. I'll usually use the one with the tag, so I'll just clean it in the morning and then it'll be okay, so you guys take the one without the tag.
I couldn't hear anything.
You got 112 over 80.
About what it normally is.
Sometimes you can turn them around.
Yeah.
Gotta find the right fit for your ears. Oh, okay.
7 times 2.
9 times 2, I guess.
Oh,
4.
well, I didn't have a watch, so.
74.
74, yeah,
You didn't have a watch? How were you counting?
I thought
When you stopped, you stopped.
I thought when you were starting,
I was trying to find it for a while, and then
Oh.
once I got it, I started counting.
Okay, what'd you get?
74.
Okay,
Need a watch?
Would you-
okay. Next. Yeah, if you're gonna work in the hospital, you wanna have a watch with a second hand. What device?
Quirky.
Okay.
Okay, Michael, I would like you to bring your right hand off the floor. I'm going to help you to put your left leg on the floor. And I'm going to unlock the seatbelt. So please move forward on your right, on your left. Okay, good. Okay, I want you to push yourself up with your right arm while you're on your back.
Okay.
And when you set up, reach the ball, okay?
Okay.
On the count of 1, 2, 3. So Michael, how tall are you?
5'9".
Put your hand down.
It's convenient.
Okay, good. I would like you to reach the armrest with your right hand. Reach. Good. Sit down.
That's all right. It's fine.
All right, so first, can you please have your right foot pick up your left foot? This is
Anybody doing anything in the bars?
Anybody else?
No? Okay.
I'm just reading one at a time. Right CA, left side is, so right side is okay, all right. So, all right, can you pick that up for me? Just like that? Make sure the seatbelt, all right, nice. So we are gonna go to your right side. Oh!
Now both feet hurt.
Make sure that is good.
Alright.
Right.
So let's see. Alright. So can you take off the seatbelt using your right hand? Alright, so you could uncross your legs. Alright, so what I'm gonna do a lift. Yep. I will do a lift because it's hard for him to, yeah.
Why not a
I
simple?
thought I have a good.
You don't wanna lift him. He's
Yeah,
got
but
fair
also,
plus
like-
strength on that.
He's got a honey.
Also got pain with the right ankle, so it's gonna be putting a lot of weight on that as well.
It's way past
Alright, let's do stand pivot. So, I'm gonna transfer our patient, so.
Just don't
from
forget,
the-
we're always trying to think about home, right?
Gotcha. So I'm gonna use.
You may have a tiny little weak wife that can't lift them.
So I'm gonna use a stand pivot from the wheelchair to the mat.
Okay.
Using moderate assistance.
Okay.
Alright, so can you please scoot up closer to the edge of the chair?
By the way, I won't be saying anything, right, on the test.
Just make
I
sure
won't be
this is still
giving you
locked.
any feedback, and I'll hopefully have a blank face and not like,
If possible, I'll try to use your right hand to push yourself up. I'm gonna give you a little bit of help. I'm gonna stand, okay? On the count of 3. Oh, wait. 1 moment. Left leg. Let me do this. So you're gonna try to. I know your right ankle hurts, but you're gonna try to put most of your weight over here if possible, only for a couple of seconds.
good, that's
Alright.
good.
1, 2, 3. Let's stand. All right. We're turning. Now reach. There we go. Alright, next person.
Oh,
Modality, I guess, so whichever else.
Okay. How you doing, Michael? How are you?
Good.
Dennis, I'm assisting Alan's. I'm just gonna do a few tests to check your senses. So I've already tested the right side. I'm gonna test your left side.
Focus.
So okay. I want you to. Alright, I want you to close your eyes and tell me if you feel something.
Mm-hmm.
Feel that? What do you feel?
Yeah, but what I feel on my
We're finding out.
Well, alright. Do you feel something? Did you feel that? Okay. Did you feel that? Okay. Now I'm gonna test sharp and dull. Okay, tell me if you feel sharp or dull.
Sharp. Dull. Sharp. Dull.
Okay. And tell me if you feel hot or cold.
Hot. Cold. I'm making it up. Hot. Ooh, for you.
All right, very good. Now I'm gonna get some ice for your ankle, so we can get that swelling down. Okay.
Okay.
So.
So, how come you didn't test the ankle?
That's the question.
Just curious.
This arm.
Now that your left arm is good, we're gonna.
Well, because he just had a stroke, so I wanna test.
You shouldn't check.
But you're not putting
Go
whatever.
ahead.
Um,
Rewind,
Yeah, you kind of do like above and
Peanut
below
gallery.
The joint, I thought.
the joint that you're treating.
Right. Yeah.
You're doing that.
Yeah. But he should. Yeah.
The joint that you're treating.
Yeah.
You wanna test the area you're treating.
Right. Okay. So, I got a cervical cold pack. Move this out of the way. Okay. And Michael, can you lie onto your left side? Or actually, no, I'm sorry. Lie onto your right side. Onto your right arm, and then help bring your leg onto the table. And take your shoes off. Take off the other. They're on the bed.
Well, it's on the bed, so, yeah.
Yeah. Alright.
Your next patient doesn't wanna put their head there.
That goes around the ankle. sock. Wrap the ankle. Okay, Michael, I'm gonna set a timer for 10 minutes, but I'm gonna come back in 5 minutes just to make sure that everything's okay, all right?
Awesome.
And here's a bell.
Okay, what are 2 indications, 2 contraindications of ice?
Indications, inflammation, and inflammation on the right ankle, but I could use it on the left side to reduce spasticity. Contraindications is maybe a lack of sensation and the fact that he's older, so having a stroke and being elderly.
Okay. Okay. Next. Take it off.
I'm gonna mess this up.
Whoa, positive attitude.
I said I'm gonna mess it up. That's not positive.
Give the poor guy a pillow, he's just had pneumonia.
I was gonna use all these pillows.
Are you gonna do chest PT?
Yeah. There.
Wait, Ryan's doing the MMT.
Oh, sorry. My bad.
So excited.
No, I'm not.
It's okay.
Because I think I was going
It's a
after
judgment-free
Dennis.
zone.
Okay, all right, let me try to do this, because I have a question here. Look, he has a grade 3, he's a fair plus, so he can resist in gravity. So I think he should be seated, right?
I would do it
Okay.
seated, correct. So maybe you wanna do it later, let other people do
Oh, yeah.
the stuff in supine first.
Okay.
Yeah, you don't wanna flip your patient up, down,
Yeah,
up,
that's
down,
okay.
up, down, especially this patient, right? So make sure you make it efficient for the patient. So anybody wanna do anything in supine?
Maybe chest PT.
It doesn't matter. Are you gonna do a sitting?
Just do range of motion too, if it's just wrist, but.
I guess I go.
Yeah.
Just because.
Yeah. Well, I'll need more pillows, but I guess I'll just use these. Huh?
It's okay. It's time to learn. It's okay.
There's some back on.
Believe in yourself.
Now you have me questioning.
Do whatever you want.
Exactly. Believe in yourself.
Yeah, do what you were gonna do.
It's okay.
Sure, correct.
We're not gonna judge you.
None of us know how to deal with that.
None of us want to do this right now.
So can you lift your right leg?
Can't move.
Try to get the pillows. Careful. Can you lift up your butt? Yes. I would add more pillows to have him higher, because I'm doing the lower lobes.
Okay.
And then percussion. I would go like this. Of both lobes.
Where's this pneumonia?
Uh,
Lower.
oh, yeah. Lower lobes, and it's both.
Okay.
So I would go here. I don't know, I'm doing this wrong.
Those lower lobes?
Yep. I don't know.
Well, if you don't want to go prone, you could do sideline, right?
I would do a side to side on this patient. Side to side, head flat. Is it true postural drainage? No, but it's the best you can do for this gentleman,
Okay.
okay? This way you could get posterior, lateral, and anterior all together. And the chest, good.
Good.
Make sure
So,
you're in the lower lobes.
and I'm doing
Posterior, lateral,
bilateral.
anterior. Huh?
I'm doing bilateral, I don't know. I find it
Well,
hard.
bilateral you can't do. You have to do the other side.
I have to
You
do-
have to switch.
Oh, I can only do one side at a time?
Correct. Because you want to get all aspects of the lower lobe. So right now, just focus on the posterior, lateral, and anterior aspect of the left lower lobe.
Okay, alright, so I'm gonna do percussion, and I want you to, do like a hissing sound and exhale.
Let me see some percussion first. Let me see percussion first. All the lobes, all the lobes, all the aspects, anterior, lateral, posterior. Cup, cup.
Wow, that is a big difference.
Yeah. Is that better?
Yeah.
More slapping. Better, better.
Okay, so I want you to exhale at the same time.
First
Um,
inhale.
Oh yeah, inhale, take a deep breath, and now exhale and do like a
No, you're vibrating, vibrating.
Oh yeah, that's for vibration.
I think we're reviewing this. No, vibrate, vibrate.
Oh, now vibration.
Vibration on exhalation.
So.
Deep breath in.
Do I have to use a towel because we learned with a towel?
That's more
Oh,
shaking.
yeah.
Shake.
Deep breath in.
Deep breath in.
Pucker your lips and blow in. Vibrate towards the bronchus. Towards the bronchus. Vibrate, vibrate, vibrate.
I'm so bad at it.
Okay, let me show you. Okay, deep breath in. Pucker your lips and blow towards the bronchus. Deep breath in. Pucker your lips and blow.
And then you cough at the end, right?
Yes, please. Sit up.
Good. Oh, sit up. Come up.
So you don't choke.
Oh yeah. And I'll have a napkin.
Deep, yep, don't forget your napkin.
Alright. And I want you to cough.
Deep breath in.
Deep breath in. Take big.
Extend your trunk and 2 big coughs. You guys forgot your chest PTSD.
Yes.
We
Alright.
didn't know we were gonna be tested on that later on.
Fair game, anything's fair game.
We don't need to remember that.
And then the other side.
Let's do the other side.
Okay. All right, we won't torture you anymore.
No? Oh.
Don't forget
It's a
to
long
do both
intervention.
sides.
Don't wanna draw that card.
No.
That takes a lot of time.
Huh?
That takes a lot of time.
Here goes.
No. 2 minutes. Position, percuss, vibrate, up cough, turn around, percuss. I'm not gonna make you do 2 minutes percussions, but you should do 2 minutes. But I wanna see some good percussion.
So why did you say sideline?
It's modified position because this guy is 80, had pneumonia, he had a lot of other things to do. So save time, save his energy, do flat. Now, it's not a typical postural drainage position, but I don't think he could go prone, right?
Yeah.
I don't think he could go supine with his, his head down. It's gonna be too difficult for him, so you modify a side-to-side position.
Okay, Michael. I'll be doing.
And we're gonna be way over time, obviously, but we're already at 25 minutes.
Okay.
Okay, go ahead.
Okay, Michael, I'm going to do a test on your right leg. I'm going to test the muscles that will make you cross your leg.
Okay.
So what I want you to do is you're gonna place your right foot over and then slowly bring it up as high as you can.
Okay, what kind of test are you doing,
Okay.
Ryan?
I'm going to test the manual muscle testing on the right sartorius.
Okay, at what grade?
Grade is F plus, that's grade 3.
Okay,
Okay, which is
3 plus, yeah.
3 plus slight resistance.
Okay, let me see.
Okay, now since I showed it to you, I'm going to place my hand around here and I'm going to palpate. I'm going to touch here so I would know if your muscles that will make your leg cross is working. All right? On the count of 3, brace. 1, 2, 3, go. Raise it. Good. No. You have to raise your foot around here. Okay, 1, 2, 3, go. Go. Okay. Good. Okay, one more. Place your foot here. Last test. Go. Go.
How much resistance you putting?
I have slight resistance only.
Okay,
Because if I push too hard, you won't be able to lift it.
correct.
So hi Michael, Darren. So today I'm just gonna work on your left arm, so to make it better. So obviously this chair won't have wheels.
Okay, why don't you take a chair? That one was just to give yourself the real.
This,
real
over there, still there.
No, because I'm gonna do my. Okay.
Darren, Darren.
The arrangement.
That's good.
Yeah, it's better.
Yeah, otherwise I'm just gonna have you.
It's better to do it there. Either pre or
Alright,
pre
Mike,
or
makes
post
sense.
trade.
Makes
Right.
Sorry, go ahead.
Alright Michael, so I'm gonna try to resist your right elbow extension.
Okay.
And then his left arm has a stage 2, so that's gonna be like spastic. So it's gonna be on the
Coming into spasticity.
right. Alright, so I'm gonna try to resist your right arm. Alright?
Okay, tell me the motions of the joint. You're gonna resist, right,
I'm gonna resist right right arm.
right, joint and motion.
Oh, elbow joint
Elbow, motion,
extension.
thank you.
Alright.
To promote,
Promote extension on the left arm. Left elbow extension.
thank you. So he's resisting right elbow extension to promote left elbow extension,
Alright,
okay? Give me the joint and the motion.
Alright, kind of 1, 2, 3, okay. 1, 2, 3. Alright, push. Alright, one more time. Ready? 1, 2, 3. Push.
Anybody tell him, try to extend your left,
Oh, right.
try to straighten your left elbow.
Alright, so Michael, try to extend your left elbow too, okay? Alright, 1, 2, 3. Push. So this way, the energy overflow is gonna go to the spastic arm.
Okay, good.
I actually add something different. So, I'm gonna do alternating isometrics to promote his sitting dynamic balance.
Okay,
It's your left upper extremities in stage 2, right? So, like this, but you can passively bring it down to the mat, right? Place this one here. So what I'm gonna do is I'm just gonna try to push you over to one side, just to let me move you. I can still get some resistance, so. Don't let me move you, don't let me move you, don't let me move you. Don't let me move you, don't let me move you. This. This way. And diagonally. And just guarding his knees.
okay, good, move on. Who's next?
I think you're looking for a going.
Oh, is that one underneath?
I'm not
There
going
was a
next thing.
goniometer here
Oh, you're
somewhere.
not?
There should be
Come
one.
to the chair.
For me to move to the chair first?
There you go.
Yeah.
Sorry.
So I'm gonna transfer Michael from the bed to the chair, using standing pivot. That's right side. Alright, Michael, just like
With
how
what
you
kind of assistance?
moderate.
Moderate?
Just like you did before, Michael, you're gonna come all your way onto your right, even though I know it hurts right now.
Move the
Just
chair
for
a
a few
little closer
seconds.
to him.
And then you're gonna reach for the chair and you're gonna sit down. Okay? Alright, can you scoot your legs behind you? And you move your back one. And you scoot towards the edge of the bed. Yeah, edge of the bed. Okay, You're gonna come up, you're gonna put most of your weight onto your right and then reach for the chair, okay? 1, 2, 3. Reach it. And it's about. Can you put the leg rest on?
Yeah, you don't have to.
We should be around that way anyway.
What's next?
All right, range of motion.
Oh, sorry.
Hello, Michael. I'm just gonna turn your chair so I can have access to the left side of your arm, okay? Of course. Okay, so I'm gonna roll and you can pick up your feet. Over to the side. I'll lock the chair. Lock the chair. Okay. This isn't go any lower. Okay, this is uncomfortable. So I'm just gonna move your arm further back until your wrist can hang off the edge of your armrest. And I'm gonna line up my goniometer. The fulcrum is gonna be just proximal to the styloid process, the ulnar styloid process. The stabilizing arm is the midline of the ulna, and the moving arm is in line with the fifth metacarpal. Okay, so I'm starting at 0. And on the count of 3, Michael, I want you to bend your wrist as far as you can, okay? So, 1, 2, 3.
So he's developing some spasticity in that arm, so you might have to just help him a little bit.
That's all I can do. Okay. Should I test the passive range of motion or the active range of
No,
motion?
I just, you never know if the hand's a little bit spastic, so it's
Okay.
okay.
Alright, so I got 40 degrees. Normal is 90 degrees, and it should be firm.
How'd you get 40?
He's pretending.
acting.
Oh, okay.
No, he's pretending.
Okay,
So,
and normal
Also,
is?
if I try to go like
Normal is 90.
Okay, what's the infield?
Firm.
Okay.
Who's next?
Is it stand?
Stan?
Okay, Michael.
Okay, make sure, just give yourself some space over there on the left side. Just move them away from the mat a little bit, so you don't have to move them again. There you go.
Okay, Michael, I am here to show you how you can easily stand using your assistive device, which is quad pay from back. Okay, I'm gonna show you using this device. Okay. Yes, keep your legs like that. Your strong side is right, so always keep your device on your strong side, which is right. Keep this legs away from you, okay? Use your armrest to push, but first always scoot to the edge of the wheelchair. Of course, unlock your seatbelt, okay? Use your left. Can you passively move your left arm toward wheelchair? Okay, thank you. Unlock your seatbelt. Scoot forward. Okay, and I'm gonna show you how to do this. Use your left, lean forward, use momentum, nose over toes, and reach for your quad K. Not now, but.
I know exactly what to do. That's what they'll do. Those right CBAs, they're up before you know it.
misunderstanding.
I wasn't trying to be smart, I thought that's what you wanted to do.
Sorry, I
Just you had me
just
scoot
wanted-
forward.
Yeah, I just want to
Sorry, I
show
thought
you
that's-
first, but you are doing great, so we can repeat this. Great, thank you.
Okay, who is doing?
Excellent, thanks.
But I'm a little mixed up. I was actually gonna put it, given the pain on the right, I was gonna treat the left like the good side. They're both, I mean, both lower extremities are compromised, but I don't know.
Yeah, no,
I don't
I
know.
would stand on his CBA side.
Okay, so the right is considered the good side?
Yes.
It's right, okay,
Yes.
all right. Hi, Michael, I'm Liz.
Hello.
So give me your
Um,
sentence.
So I'm gonna ambulate my patient, using a 2-point gait, with a quad cane and contact guard?
Okay.
Is that too ambitious?
As long as your hands are on him, I think it's okay.
Okay, all
It's a
right,
little short,
so,
no?
yeah.
He's a people.
A little
yeah.
short.
Have long arms.
Who measured that?
Is it, or should we just go on?
I'm sorry,
Should I fix it or should we just go
go ahead.
on? Okay. All right, Michael, so what I'd like you to do is, you're gonna bring your cane, forward and your left leg, the leg closest to me. Good, and now step with your right. Good, all right, so cane and left. And step with your right. And if you can, do the cane and the left leg at the same time.
Mhm.
Let's try that. Cane and left. Good, and right. Great.
Step
Cane and
through,
left.
Forget. Step
And-
through.
Cane and left. And right. And go ahead and bring that right leg a little further. Cane and left. And right all the way through. Good. Cane and left. Right all the way through. Great. Cane and left. Right all the way through. Cane and left and right. And just hang here for a second. So tell what, do you have railings on your stairs at home?
No.
No, okay. Alrighty, so what we're gonna do now, I'm going to have you, put your right foot up on the step. Great, and now bring your left leg and your cane at the same time, ready? Left and cane, good. Alright, go up with your right,
Switch the cane.
switch the cane.
Sideways, no sideways.
Oh, yeah.
Yeah, it's gonna throw him off.
Okay, could you turn
Make sure all
your-
4 tips are on this.
Yeah. Could you turn your cane 45 degrees? Great. Okay, now come up with your left leg and cane. Oh my gosh. Okay. All right, the right foot. Okay, left leg and cane. Good. Right foot, left leg and cane. Good. Okay, so now you're gonna turn.
I feel dizzy.
Oh my gosh. Turn to your right. Okay, great, hilarious. Okay. Come on down with your left leg. Good, good.
And the cane,
And a cane?
cane and the left foot go together.
Okay, sorry, bring your right leg down. Okay, cane and left. Okay, and right. Good, cane and left. Good, and right. Cane and left. Good, and right. Okay. Someone else is taking over.
Giving up on me?
Absolutely not.
Oh, I'm gonna get hurt.
So I'm going to elevate my patient back to the chair using a 3-point quad cane and 3-point cane with such a word.
Regressing now?
Regress.
I want you to please move forward the cane. Now your left leg. Now your right leg. Cane. Left leg. Right leg. Cane. Left leg. Right leg. Can you show me how to do it? Okay, great.
I agree.
Okay, we went to the chair. Okay, Michael, I want you to turn to your right side. And now, reach with your right side, the armrest.
Make sure your legs are touching.
Oh.
Back up till the legs are touching. Make sure the legs are touching the chair.
Okay, reach for the armrest and then sit. And then just sit with.
Never want to have a patient sit down unless their legs are touching to where they're gonna sit. Okay, 41 minutes.
That was
Plenty of time, yeah.